Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, ladies and gentlemen. Good evening. Thank you, Dr. Ilham and Dr. Noor Huda, making my job a bit easy. Just I want to share my experience of a pediatric head injury, which is related to our unit. As briefly, previous speeches, in previous speeches, we have briefly gone through the epidemiology. And just briefly going through it is that 650,000 to 1 million children are evaluated for head injury in a year in ER. And 80 to 90% are those who are suffered with mild hand injury. In developed countries, most common cause of death and disability is basically head injury. In US, 37,000 admissions and there are 2,000 deaths. And the causes are in infants, the abuse is most common cause, as it was discussed by Dr. Ilham. But in Pakistan, in my 10-year experience, I haven't seen children with 2 year and below with abuse. And other abuses are common in children 5 years and above. In toddlers, fall and abuse, school age, motor vehicle accident, and sports, probably they are much more exposed to the outer environment and school and to school. In adolescent, motor vehicle accidents, sports, and assaults are common. And as in other diseases, we can see that there is male predominances in head trauma in children. Acceleration, deacceleration, rotational injuries, and direct blow to the head are the main cause. And the pediatric anatomy is a kind of, they have got a unique anatomy. That is, they have got more distensible skull. They have got open sutures. They have thin bony cortex. They have no frontal air sinuses, so their head is much more heavier with weak neck muscles. And they have got poor coordination and balance. There's also difference in immunity. Obviously, there's low immunity at this age. And they have got less capability of maintaining their body temperature. Again, poor history and examination, underestimations of the different polytraumas. These kids are much more prone to develop diffuse axonal injuries and brain swelling as compared to adults. The degree of head injury in children is again categorized according to the GCS score into mild, moderate, and severe. And types of head injuries include the most common are diffuse axonal injuries, fractures, intracranial hematomas, and contusion. Glasgow Coma scale is same as that in adult, except for the children below 4 years of age. We have got changes or differences in the verbal response. According to the clinical features, we can divide these kids into high risk and intermediate risk and low risk groups. In high risk, there is suspicion of child abuse, alterment of mental status, persistent vomiting, seizures, the use of anticoagulants, and those kids who are previously shunted. While those with the intermediate risk are with the self-limiting vomiting with loss of consciousness less than 5 seconds, with resolved irritability, high-risk mechanisms of head injury, unwitnessed trauma, and those kids with age less than 3 months. These are the steps of the physical examination of the trauma kid. We can see the CT scan with the depressed skull fracture. We can see in the occipital area and in the posterior fossa, and these are the post-op pics. And again, a CT scan with the left frontal contusion, deep-seated. Okay, we can see this. This is a predisposing cause for head injury in children. The treatment is steps should be taken toward to prevent secondary head injury, to identify treatable Moss lesion, identify other life-threatening injuries. Now we quickly go through our study, which is an audit of 1 year. And the objective was to analyze the data of children with head injury presented to our unit during 1 year duration. And it was carried out in Lady Reading Hospital. And the total number of cases were 703. And all the children of 15 years and below were included in the study. The total number of the patient who had presented in casualty, which includes the adults as well, it was 1,980, out of which 730 were children of 15 and below 15 years of age with head injury. That comprised of about 35.5% of the trauma patient or trauma population. The total number of the patient who has been expired in trauma room were 152, out of which 13 were children, and that comprised of 88.5%. And these the patients who are expired are basically the head injury patients, not the other patient. The boys are more commonly affected. Maybe they are more enthusiastic and more active. And if you see the age distribution, we have divided the children into 3 age groups, that is 0 to 5 years, 6 to 10 years, 11 to 15 years. And the common age group that was affected was 6 to 10 years. That comprises of about 25.6%. The common mechanism of injury was history of fall. That comprises of 46.8%. The most common type of the degree of head injury was moderate head injury, and it was about 52.1%, which was followed by mild head injury and severe head injury. The common surgical procedures which are performed was elevation of depressed skull fracture and neuroplasty. That comprised of about 17%, followed by VP shunt with interventricular hemorrhages and post-traumatic post-traumatic hydrocephalus. This is the ICU data. These are the serious patients which have been shifted from emergency room. The total number of the patients which were shifted were 489 throughout the year, and out of which 72 were children. And that comprised of about 14.7%. The mortality in ICU, that was 42, and that comprised of 15% of the patient who suffered head injury. The mortality of different age group in ICU, we have seen that mortality was common in children 11 to 15 years of age. Probably they were suffered with severe head injury as compared to the rest of the kids. That comprised of 42.9%. The common mechanism of injury was history of fall, 59.5%, who landed in ICU. This is the ICU data. Those who have been shifted with moderate head injury to the ward, and then later on they have they have developed some complications, and they were expired in the ward, and they comprised of about 4.6%. When we do comparison with other studies, we can see that in Croce et al., there was a study of 1,115 patients, and most commonly the patient who presented to ER were with the mild head injury. And while in our study, the moderate head injury was a common presentation. And again, the male were more common than female. And the age at which the presentation was more were below 3 years of age in Croce et al. But in our, it was 6 to 10 years. The mechanism commonly involved were fall, sports, and motor vehicle accident, while in our study, the most common mechanism was history of fall, and that comprised of 46.8%. So in our conclusion, we want to say that males suffer trauma more than females, as in the adult population. History of fall was common mechanism of injury. Common age group involved was 6 to 10 years. Moderate head injury was a common presentation. And the common procedure we performed was elevation of depressed skull fracture with or without neuroplasty. And patient expired in the trauma room was 8.5%. Almost 1/3 of the neurotrauma patients are in pediatric age group, and they need special care. Separate pediatric head injury bay and IC care are required. Proper trained staff and equipment, multidisciplinary disciplinary approach, and polytrauma patient under one roof. Prevention is the prevention steps that we can take are home safety measures, road safety measures, proper school buses. Kids should not be allowed to ride a motorbike, overcrowded school vans. Proper road crossing spots and bridges are required. Sports activity under protection, avoidance of kite festival, parent awareness program on TV. Reality and safety measures. This is basically a grave reality. We can see the houses are built just on the roadside. So these kids, they come out from the houses and they are much more prone to any type of injuries, maybe head injury, maybe other type of injuries. Kids riding a motorbike without a helmet. Again, sports activities. We can see kid riding a cycle going to school in a fog without a safety sticker and without a helmet. Overcrowded school vans. Again, riding the motorbike without a helmet. Again, hanging from the school van. Thank you for your attention.